Hello, this is Dr. Gay from First Look MRI. This is a 17-year-old female who twisted her knee recently, has pain, and we can tell on this sagittal view that she has an injury of her ACL just by the bone contusions. We have a contusion here of the femur. In this part that's flat, we call this the terminal sulcus. We see lots of brightness. This is marrow edema or injury of the bone. There's another contusion over here in the back of the tibia. So this is the fibula, this little bone. And the tibia is the big bone below the knee. The femur is above the knee. And we see these, what we call them kissing contusions. This bone moved forward, impacted way over here. You can see how far this shifted to hit, and then it came back to normal position. When that happens, almost always they have a high-grade partial or complete tear of the anterior cruciate ligament. And when it happens, usually the tibia will shift forward. This tibia looks like it's in a nice and normal position, so maybe some fibers of the ACL are hanging out, but just based on these typical contusions, we know they must have had an ACL injury. And if we go to the ACL, we're going to go to the middle of the joint to see that. We see here's the ACL. Instead of being a nice dark black ACL, it's all foggy and irregular. If we go in this view here, we see some of the fibers coming up, then going sideways, so we know that they're not straight and taut. They're lax and they're horizontal. And this is vertical here, so abnormal orientation, we know that it's stretched and it's either partially torn or completely torn. Probably a high-grade partial tear. Maybe there's some minimal fibers hanging on and it's very stretched. Or it could be a complete tear, but the surgeon will pull on this and be able to hopefully have an idea clinically if it's completely torn or not. And again, this tibia is not shifted forward. But I'm showing this case because there's another little blip over here behind this. This is the lateral meniscus, and right here it looks like a nice, beautiful triangle in the back. Looks like a nice, beautiful triangle in the front. Again, here's the femur, tibia, and that little black wedge is the meniscus. This is called the anterior horn, that triangle. Back here is the posterior horn. And we're looking at the peripheral rim, the outer margin. We see a little blip here. And here it doesn't look very triangular. Normally it'll be nice and triangular like this. Triangle, vertical outside, pointy towards the inside. On this one, it looks like the bottom peripheral margin here is rounded and blunted. And this may be related to a tear of what we call a meniscus fascicle. We can see here there's a linear band coming off the top, coming out from the meniscus of the joint capsule. That little linear thing there, that's a superior meniscus fascicle. It attaches the meniscus to the joint capsule back here. And there should be an inferior fascicle over here too and back. Maybe here's one here, but when we go to this view here, we see the superior fascicle and the inferior fascicle. We just don't see anything coming down. We see this little blip, and we see it rounded. So it may be that they have a tear of the inferior fascicle, and this could be the fascicle right there that's contracted up, and we lose that normal peripheral contour. Instead of being nice and pointy, 90 degrees, it's rounded, and this is kind of moved inward. So this looks like it may be a tear of the inferior meniscus fascicle. The patient also has a little tear of the anterior horn. Instead of being perfectly triangular, there's a little white thing in the middle along the inner margin that's fluid, and it's probably related to a small tear of the inner margin of this anterior horn. Usually the meniscus will just blend nice and neatly, but there's a little blip of fluid there where the meniscus may be absent. So this thing also could be a little piece of meniscus that's floated back here, but again, a fascicle injury is what I suspect. And that's it. Tear of the posterior meniscus fascicle of the lateral meniscus and an ACL tear. Thank you very much.